All right, good morning, everyone. This is the voice and the face of Dr. Tolu Olabinton. I'm the CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you're watching with us live, please hashtag live. And if you're watching with us replay, hashtag replay. And I'm excited to be having today's topic. It's a topic that's near and dear to my heart because I know the value of eating plants. And so today we're talking about, Doc, how can eating plants help me feel better? And we'll be doing so with my guest, Dr. Judy Brangman. How are you doing this morning, Doc? Good morning.
I'm good, thank you. Good morning.
All right. Now for those who are watching who are like, well, who is she? What does she do? And what's with her and plants? Can you kindly introduce yourself? Who are you and what do you do?
Sure. So I'm Dr. Judy Brangman. I'm a board certified internal medicine doctor as well as lifestyle medicine. And I've been in practice for over 10 years and currently work in a hospital setting as a hospitalist. And I also founded Newell Health, which is a virtual lifestyle medicine practice helping patients to prevent and reverse chronic diseases. We offer online courses and coaching. And I have been plant based myself for over 7, 8 years. And I help other people, women specifically, people of color, adopt a more plant friendly diet.
Okay. Now, inquiring minds want to know why do you do what you do? And this is more the with the business piece and the plant based emphasis. Why do you do what you do? Like, what got you um,
Mhm.
particularly into that niche?
Yeah, so I've always had a desire to really help patients to live better. And I was never one that believed that when you get older, you get chronic diseases, you take more medications, and that's normal. Even before I found about plant based nutrition, I always kind of had this idea in my head that there's got to be a better way, that there has to be something that we can do to prevent patients from being healthier. I mean, from being sicker, to prevent them from being sicker. And so I first discovered lifestyle medicine and plant based nutrition kind of randomly, I guess. But I met someone who had come off of all of the diabetes medications after adopting a whole food plant based diet. And I was completely blown away because I did not know that that was possible. And I was just fascinated because people spend a lot of money on medications, and the
Mhm.
complications of diabetes in particular lead to decreased quality of life, time away from work, and it just adds to the healthcare costs that the individual has to spend. And then it also affects one's mental health. If you have a chronic disease, chronic condition, like diabetes, kidney disease, renal failure, you're more likely to also experience, mental health stress and depression. And so I realized that by helping people to improve their health by eating healthier, we could improve many aspects of that person's life.
I cannot tell you how many times I've had guests come on here. We talk about if it's the mental health, if it's diabetes, if it's endocrinology, of course, diabetes is part of that, if it's cardiovascular, different specialists, and it's tied to eating. And a plant-based diet has been shown over and over and over again to be the winner. So I'm glad that you do what you do. Now, my first question, well, my next question is this. I have someone who's watching who's like, yeah, I mean, how I understand that plants make me feel better, right? So let's talk mindsets, right? Plants help me feel better, but they're not exactly exciting to eat. Like yay, some people say it's bird food. The whole grains. What would you say to that as far as a mindset or thought process?
It does take a mindset shift. I know that I have had patients say that. You want me to eat just vegetables? And they're just kind of like, that's not sustainable. That's not enjoyable. But if that's not the way that you're used to eating, it will take a mindset shift. If you look at a lot of the foods that we eat, tend to be meat heavy, especially in the US. The American diet is very heavy on animal products. And oftentimes people think that their meal is not complete if it does not have meat in it. So, first, you need to change the way that you think about food. I think about my plate as being incomplete if it doesn't have enough vegetables in it, and half of the plate should be vegetables. That's what I aim for when I eat, half the plate being fruits and vegetables. So it definitely takes a mindset shift. Another mindset shift that people need to make is this idea that eating healthy is more expensive. If you're eating fruits, vegetables, tofu, beans, a can of beans is $1.50. You can buy like a box of tofu like $2.99. If you're eating that way, that's not going to be more expensive, no matter how you slice it. But if you're eating the processed foods often, like the Impossible Burger, the fake chicken, the processed cheeses, yes, that's going to be more expensive. So I think that's another mindset shift that people need to make, because they tell themselves that eating healthy is too expensive, they can't afford it, and so they don't even try. But I also like to flip it and say, okay, let's say, even let's pretend that eating healthy costed more than eating steak, chicken, and all these other foods. What is the cost of you getting sick down the road? Heart attack. What is the cost of you being hospitalized for a couple of days and missing work? What is the cost of you not being able to walk and play with your children as freely as you want because you have shortness of breath or chest pain with exertion? What is the cost of you being overweight and being on CPAP, having sleep apnea? And you want to travel, you got to carry your CPAP machine with you. Like, what is the cost of that? And think of it that way. So think of, what is the cost of me not eating healthy? And think of it that way. Because the problem why so many people struggle with eating healthy is because you don't get immediate benefits, right? You eat, let's talk about unhealthy food. You eat something that's sugary, you immediately feel good, right? It's kind of like a high. You eat something that's fatty, you eat something that's salty, you immediately feel good as soon as you eat it. But when you eat vegetables, especially the first time, second time, third time, you may not feel anything differently. You may not feel different. That's just like the honest truth. And I think that's why sometimes people have a hard time switching, because they have a hard time thinking into the future. They're just thinking about the present, and they're more like, how do I feel today? And people oftentimes use food to make themselves feel good.
All right. So you unpacked a lot of things. We said a lot of things, and I want to unpack them a little bit. The mindset shifts, the cost issue. The truth is, one of the things I tell my clients is, whatever fruit is on sale, that's the fruit of the week. Just try it. Try something new. Whatever fruit is on sale. And when you do the math, it actually costs you more to eat out than to actually buy a groceries meal plan. Yes, it takes more effort, but I want to encourage you, as Dr. Brangman has said, it will cost you if you don't eat healthy. Now, I wanted to speak a little bit to the taste, the taste, the taste factor. Yes, that's a mindset shift. But when you know that you're worth the healthier foods that help, and number two, one of the things that helps me remember is that I know the foods are engineered to trick me into wanting to eat it more and more. They put stuff in it. It's the truth. This is not a conspiracy theory. You can Google food engineering, right? And there are things that's in the food, that's in the fried foods, that is in the breads. Why would they give you free bread in Texas Roadhouse? They're not trying to give you food. They put high corn fructose syrup in it. So that way, when you eat it, like your brain and stomach can't communicate. So you're just thinking, I gotta eat and take some home. So they're out to get you. Okay, no, seriously. So be encouraged, like Dr. Brangman has said, and remember your why. That it's going to cost you if you don't eat healthy. Now, my next question to you is this, Doc. What is it about plants that make them a good choice? Maybe that would help remind us of why we should at least, aim for half a plate of them with our meals. What would you say to that, Doc?
Yeah, plants are really important for fiber, which helps improve your gut health, your gut microbiome. And they're also important for antioxidants and phytonutrients, which are anti-inflammatory. So they help your body to reduce the level of inflammation that you have in your body. And a lot of medical conditions are caused by and related to inflammation. And if you look at populations around the world in different countries that live the longest and that live the healthiest, they all consume a large amount of plant-based foods. And it's not always a matter of completely eliminating meat, because some people, that's not what they will choose to do. But without a doubt, a majority of what we eat needs to be plant-based foods.
I love it. You essentially said to live long and well too. Plants
Yes,
are good for you.
because
Um,
what we're doing now with modern medicine, we're able to keep people alive longer, but the quality of their life becomes diminished.
mm,
And
mm,
it's like a cycle of, frequent hospitalizations once you get to a certain age. If you have several medical problems, frequent hospitalizations, frequent debility, start to get falls, or, neuropathy in your feet. And then you're needing to be in a nursing home, or you're needing someone to stay with you 24/7 to help you because you're not able to walk. And that's not the kind of life that we should be living, that we need to live. So one thing that is so important for me is to change people's beliefs about aging. I think the current belief around aging is that when you get old, your body starts to break down, and that's normal. But that's not normal. Not the way that we're breaking down.
mm, 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 mm. There's a way. There's a way to live. And a lot of us are looking forward to a future. We have goals, 5 years, 10 years, want to retire, want to travel, want to spend time with the grandkids, want to try, spend time with our loved ones, our pets, or you know. And so to ensure to work towards that goal, we want to make sure that we're feeling good, and that we're healthy, to live, to enjoy. We want you to live long and well, not just have a dragged out, miserable life. And so that's why these conversations are happening. So please be encouraged as you're watching. All right, Doc, let's get down to the nitty gritty. You said something very profound, and sometimes it's a tough conversation because when you say avoid this, eat more of these, it's like, oh my God, you don't understand. This is me. This is my culture. This is how we ate. This takes me back to my childhood. So for someone who's watching, it's like, well, how do plants make me feel better? I want you to be specific, Doc. How do they make me feel better? I eat a spinach and what? Um, oh, not a spinach, a couple of leaves of spinach. But what would you say to that, to someone who says, you know what, how can it actually help me feel better? I know the long-term effects, but in the next few days, how does it help me feel better, Doc?
So patients often report within a few days or a week or so of eating plant-based, their joint pain is better. That's a common thing that a lot of people say. And that's because of the reduced inflammation. So that's without a doubt. People that have diabetes often report an improvement in their blood sugars, so they're able to take less medications, and so they have more energy. Like, definitely more energy. You may not have more energy after one meal of plant-based or two, but if it's something that you're doing for a few days at a time, you have more energy. There was a recent film that came out with 10 people. Actually, it was called From Food to Freedom,
Hmm.
and they took 10 individuals and put them on a whole food plant-based diet for 10 days. They were all staying in a house, so the food was prepared for them. And after 10 days, they had a marked reduction in their weight. Like, people lost like 10 to 15 pounds each or something like that. And they all reported an increased energy levels, improvement in their mood, and sleeping better.
I'm putting all this down. Less joint pain. This is powerful. I want to highlight that because that's very important. So you can
Food,
actually to feel better.
yeah, food is powerful. Healthy food is powerful. I think of it as medicine. There's a quote that says "food as medicine" or "food is medicine," but that's something else that traditional allopathic medicine doesn't really enforce or teach. I feel that eating healthy is truly transformative and is powerful. We think that, oh, you eat healthy, it may work, it may not work, but genetics will trump anything you eat. But that's not true.
Not true anymore.
We're talking now about epigenetics, meaning the lifestyle choices that you make have more of an impact as to whether you will get heart disease or whether you will get diabetes. And a lot of the reasons why medical conditions do tend to run in families is because The family all eats the same food. So if you eat the same food, you get the same diseases.
You are not your genes. Genes,
Right.
yes, you are not your genes.
Yes.
You don't necessarily have to play it out. Be encouraged. Those who are watching, don't be overwhelmed. This is information that would help us make changes that increase our longevity. This is good, Doc. Thank you so much.
Yeah, and you don't have to go fully plant-based. I get turned off actually myself with the vegan community sometimes because they're all or none. And they give the message that if you're not fully plant-based, you won't see any benefits. And so I'm kind of like that person that's like, that's not true. I have patients, when I was doing primary care, I never encouraged anyone to go fully plant-based unless that was what they wanted. But if I could see that was a stretch, you know, I would ask patients, how many fruits and vegetables do you eat in a day? And nobody was getting 5 or 6 servings at the minimum. It was like 1 or 2. So I encouraged them to eat fruit and vegetable with every meal. And I wasn't even like quantifying it. This wasn't like a study or anything, but my
Right.
patients were getting good results as far as their diabetes. Their A1C was coming down from like 10 to 7. And these are people that had diabetes for 5+ years, like a 65-year-old patient. I remember one time she was a smoker. She wasn't ready to drop smoking, but she was willing to try eating more vegetables. And when she came to me, her hemoglobin A1C was about 10.2. And then after working with me for a few months, she was down to 7.5. And for her, that was a win. And she was able to take less medications, which means spending less money.
And less side effects. So a lot of these medicines, insulin, make you feel tired.
Yeah, they do.
So this is good. Now, my next question, Doc, is this: are there tips to make them set plans more enjoyable?
Yes. I'll be honest. I do think sometimes some of the plant-based foods that you see some people cook may not be as appetizing. So what I do in my space, with my social media, the plant-based MD, I cook, but then most importantly, I really like to bring other people on that cook food that's similar to my culture. I'm originally from Bermuda, so Caribbean, African food, seasoned, flavorful. I like to bring people on like that cook food that's similar to what we're used to. So let's say greens, for example, collard greens, you traditionally would use a lot of salt and I think ham hocks or meat, some kind of meat, turkey neck or something like that in it. But you can use there's a smoked seasoning. It comes in like a bottle to kind of get that smoked flavor, and then you can use smoked paprika to also give you kind of that meaty kind of texture. So there's a lot of different things that you can use, spices, to kind of simulate certain plant-based foods to give you that nice flavor. And for me, when I cook vegetables, I cook them like they're the main entree. My favorite is to roast them in the oven. So cauliflower, for example, instead of boiling cauliflower, or steaming it, a more interesting way to me is to cut it up and put curry powder on it, and a little bit of oil as well, curry powder, a little bit of salt, and roast it in the oven on a metal pan with a little bit of oil. And it comes out really, really good. It's a really nice way to eat cauliflower. I think roasted vegetables, if you're someone that doesn't like vegetables, if you roast them, you're going to find a better, probably more enjoyable flavor profile than steaming them or boiling them. I wouldn't boil them because that's just the vitamins kind of go out in the water, but roasting them is going to be more enjoyable for you.
I
And
love
use the same seasonings. Yes, I like that you put that there. Use some of the same seasonings that you would season meat with. Like I just said, curry powder on cauliflower.
Yeah, I'm a big fan of cilantro. I love cilantro.
Yeah, I love cilantro. Fresh herbs. Really good too. Thyme, rosemary.
So we got options. We have options. Now, my next question to you is this, and thank you for those tips. How come fruits that are not good for us taste better? I alluded to it earlier, but I wanted us to.
Yeah, you touched on it earlier too. They are tailoring the foods to get you addicted. Like
Mm.
literally, they put the foods contain foods such as high fructose corn syrup, sugar, salt, and fat. So those three things, sugar, salt, and fat, almost give you sort of like a high, cause your endorphins to go up, and you become addicted to it, or you will crave that specific food. If you look at food ingredients really closely, they put sugar in a lot of foods that you think are not sweet foods. Sometimes I notice that savory dishes would have sugar in it or high fructose corn syrup. It's because it activates a part of our brain that kind of leads to cravings and gets us kind of hooked on eating that particular food.
Okay. So, and for those who are wondering, who are like, are you sure this is true? You can just Google food engineering. There's a whole science to it. It's part of why when you go to a place to eat, they give you certain things before to kind of get those sensors going, so that you're more driven by your craving than the fact that you're full. Okay.
Yeah. Also on cheese, if viewers want to look up about cheese too, there's a book that Dr. Neil Barnard wrote about cheese and how and why cheese is addictive, and it talks about casomorphins, which basically, um, I think it's either produced by cheese or your body makes it, but it stimulates the same part of the brain that is stimulated by opioids. So it gives you that same kind of positive feeling or that rush. And that's one reason why cheese is very hard for a lot of people to give up.
So
Cheese
interesting.
definitely is very addictive, and that has salt and fat in it.
Yes. And it's ironic you're saying that. A lot of things I'm having to do lately is encourage my patients to cut down on cheese because of cholesterol. It's the number one cause, actually one of the number one causes of high cholesterol in the U.S. is cheese. So, these conversations are had to encourage you to make informed decision, meaning you're making a decision based on what you know. Um, and so, Doc, for someone who's watching, who's like, man, Doc, man, I didn't know all of this, and now I feel like can't, I'm a little afraid. I'm worried. I want to eat healthy, but I enjoy. I mean, my food is a big part of who I am. What would you say to that person who's a little nervous? Like, where do you start from? How do you encourage them in their journey to eating healthier?
Yes, I would say start with your why. You have to have a compelling reason for why you want to eat healthier, live healthier. People are more motivated by positive feedback as opposed to being motivated by fear. So, as healthcare professionals, sometimes we try and motivate people by fear. They say, "Oh, if you don't eat healthy, you're going to get a heart attack," or "If you don't eat healthy, you're going to end up with kidney disease." But a more lasting motivator would be for an individual to say, "Okay, what can I gain from eating healthier? Is it because I want to live longer for my children? Is it because I am tired of not being able to walk outside and play with my children or my grandchildren?" So have a compelling reason for your why. Everything starts with the why. Write that down on a piece of paper, think about it, and then come up with a game plan to help you to achieve whatever it is that you want to achieve. Like when we, counsel patients and do coaching, we talk about like SMART goals, but I'm not going to go into detail about a SMART goal, but start with a baby step. So rather than saying, I want to lose weight or I want to eat healthier, evaluate what you're currently doing and see what needs to be changed. The easiest thing I think is most people probably aren't eating enough vegetables. So I would say increase your vegetables and quantify it. So maybe do a food diary for a couple of days, see what you're eating. And if you find that you're only eating one serving of vegetables with each meal, say, okay, I'm going to eat 2 servings or 3 servings, whatever you choose, but make something that's specific, it's measurable, make sure it's something that you can achieve that's realistic. Don't be unrealistic and say, I'm going to go fully plant-based tomorrow. I mean, to you. Pick something that's realistic because then you can reward yourself and you'll feel good once you achieved it. So that's what I would say. Your why, come up with a game plan and have a specific goal for a specific time period. So say for the next 2 weeks, instead of eating one vegetable with dinner, I'm going to have two vegetables with dinner.
There we go.
And this is what vegetable I'm going to eat. So make it as specific as possible, because if you don't, it may not get done.
Awesome, awesome. Thank you for the practical tips. Thank you for making it easy and relatable. For watching, we're rooting for you. Okay, we're rooting for you. Start baby steps and remember your why. Now, for those who are watching, who are like, man, I like this Dr. Judy. I wanted to come talk to my audience. I would like to work with her. I'd like to connect with her or follow her and see what else I can learn from her. Doc, where can people find you?
So you can find me on Instagram at the Plant-Based MD and Facebook as well, Dr. Judy MD. And my website is theplantbasedmd.com. You can message me on social media, send me an email through my website. I would love to connect with you. I do webinars, speaking, and I have an online course or a program that I'll be launching again soon. So would definitely love to connect with your audience.
Awesome, awesome. And we've put all the informations, your website, the Instagram handle, and the Facebook handle on the screen and in the comment section so people can connect with you there. Thank you so much for coming and for blessing our audience. I really appreciate you, dog.
Thank you so much. Have a good day.
And we're going to have this conversation soon, okay? We'll do this again maybe in a couple of months, have a refresher and, talk about other things we could do or re-emphasize the things we talked about today.
Okay. Yes, I'd love to hear if there were any viewers that tried something different, a new recipe or something, how that worked for them.
All right, that's your homework. For those who are watching,
yes.
Play, that's your homework. Comment and let us know what you've tried since hearing this discussion, what you've implemented, and how we can encourage you. This is good. Thank you for that.
Yes.
All right. And thank you for those who watch live. I appreciate you. As always, please share with friends and family by simply commenting or tagging them in the comment section or forwarding this video to them. And if you or anyone you know, as always, is looking for an awesome, a thorough, and a passionate family physician that will have conversations like these as far as plants to help you live long and well, I am she. Have a good one. Thank you so much, Doc. I appreciate you.
You're welcome.